the growth has been great. I think that there's so many tailwinds that are helping us along. And like as a reproductive psychiatrist, I'm very excited that we finally have data that's being published, by the CDC, by the health insurance companies on what a big problem this is, on what the costs are. And so there's definitely much more motivation, I think, to address a lot of the issues that we're treating than there were even 2 or 3 years ago.
Hi, everyone. Welcome back. Today, we are interviewing Dr. Laddha. She's a board certified psychiatrist and the co-founder and CEO of Luna Joy, which we will get into exactly what this company does. She did her training at SUNY Buffalo, where she went for medical school, then went to Emory to complete her residency in psychiatry, and now lives in Atlanta, Georgia with her husband and her 4 children. So really excited to talk to her today about how she went from being a private practice psychiatrist to now building one of the nation's hopefully largest mental health providers. Before we dive in, I do want to have a disclaimer that I am an investor in Luna Joy and the company. I was actually one of their first investors, and I happened to be postpartum at the time, having some anxiety issues of my own, and the conversation couldn't have come at a better time when I got introduced to her. So I'm going to try to keep this interview as free of bias as possible, but just so you all know, there is some inherent bias because I am an investor and a full believer in what Luna Joy is up to. So welcome, Dr. Laddha. Thanks for being here.
Thanks for having me.
So just to start off, what is Luna Joy? Can you tell our audience what it's all about?
Sure. So Luna Joy Health is there's 2 components. One is a behavioral health clinic, which is all virtual, and that's medication management, psychotherapy groups, just done online and through insurance. And then the other portion of what we do is behavioral health integration directly into OB offices, primary care offices, and health systems. So it's 2 parts, both the care navigation connecting directly with primary care, OB care, where patients are already screening positive, as well as care services.
So what does that mean, really? So when you say care navigation as a patient, like what does that mean for a patient?
Sure. So right now, patients come in, they're seeing their primary care doctors, maybe they're seeing their OBs if they're pregnant or postpartum, and they're going about their normal care. And we're often doing, as we should, as ACOG recommends, screenings, right? Especially on pregnant and postpartum women. So we're looking at their mental health through the EPDS. What typically happens is a woman will screen positive at the OB office or her primary care office. And when that screen is positive, we put the onus back on the patient and we say, like, hey, it looks like some stuff is going on. Your screen is positive or your score is high. You should go get a psychiatrist or you should go get a therapist. And then we send that patient along their way. And then typically they go home and they try to call a bunch of numbers. They get on lots of wait lists, or the options are all private pay and not affordable. And then they put it away, especially if they're depressed and anxious, right? It makes it even harder to do that. And so when we talk about care navigation, we talk about really creating that connection direct from OB or direct from primary care. The second that woman screens positive, we actually get pinged on our back end, and we're able to outreach the patient within just a couple of hours of a positive screen to give them access to education and resources, and most importantly, an in-network appointment that they can do virtually. So we're decreasing the barrier to getting into care, increasing the screening, and then increasing the connection to actual intervention from there.
And when you say screen positive, is this mostly for postpartum depression, anxiety? What are the major things that you are seeing coming through?
Yeah. Depression, and it can be run of the mill, regular depression, regular anxiety, pregnancy related depression and anxiety. And we need to start calling it prenatal depression and anxiety as opposed to postpartum, because 60% of women, the symptoms start during pregnancy. We're just not typically looking or asking. And so really the whole gamut. And on the clinic side, we do see men, women. We don't turn people away based upon gender or age, but our focus and our specialization is on that perinatal space.
Okay, awesome. Tell me a little bit about the backstory of Luna Joy. So you were practicing psychiatry, private practice. You had your own private practice. Is that correct?
Mm-hmm.
And you decided to start a national healthcare company, which is a very big decision, especially because healthcare businesses are pretty complicated to get started. I know, having started one, starting a couple actually. And you did this with your brother's wife. So adding even more spice into the equation.
Yeah.
I know you guys get along, but yeah, when you hear that, it could get contentious. So tell me all about that. What were the conversations that happened, and how did you both decide that this is what you're gonna do?
Yeah, so I think that I've always been a builder at heart. I mean, I think that that was really going into medicine to go and solve big problems. And at the time, I thought it was going to be for individual people, and that's what I did in private practice. And when I worked in the health system, it was very one-to-one, seeing patients one-to-one. I started my private practice right out of residency, so I've always been entrepreneurial at heart. Wanting to kind of get out there and create something of value. And then after 7 years of working very closely with pregnant and postpartum patients and taking care of these people in my private practice and also having my own experiences, which I'll get into in a second, just decided that there are like some significant repeatable problems or holes and gaps in the system that can be solved by technology. And, unlike all of the innovation that's going on the pharmaceutical side and even in health tech, this felt very simple to me. It was a conduit that needed to be created between OB care and mental health care that was seamless and that was quick and that was responsive, right? And then the other part of what I had seen as a private practice physician is that unlike in so many other parts of medicine, there's no preventative care in psychiatry. And so I would see the same kind of groups of people with the same risk factors, and all we do is wait for people to get sick, and then we try to respond in this crisis fashion when women are not feeling well. And it was bizarre because we know what causes this. We are able to predict with pretty high certainty who's at risk and who might develop symptoms. And so the fact that I'm seeing people months or years even after symptoms start, as opposed to like before, it just felt wild that we weren't using a lot of this data that we had in a predictive and preventative fashion. And so I really wanted to build in that way. On the private practice side, during my span of years at the end of residency and private practice, I had 4 kids within that time. I was pregnant with twins during my 3rd and 4th year of residency, had them while I was like actively getting my perinatal specialization, working at Emory under Toby Goldsmith, learning all of this. And so it was just a really interesting time, right? I was seeing the huge wait times that pregnant postpartum patients were facing, the real difficulty in getting into care, and then going through my own pregnancy journey. Had 60 touch points with my medical team, but there wasn't one mental health questionnaire. There was really no safety net that was built. And I ended up having pretty significant postpartum anxiety. And so it was a really bizarre thing to kind of think about all of this care that had been completed, but I had twins that were healthy and happy, but really bad anxiety, and also felt like I had nowhere to turn, and there were no in-network options as a resident. I couldn't afford to pay hundreds of dollars an hour for an outpatient, psychiatry visit. And that was 9 years ago, right? So my twins are 9 now, and after 7 years of clinical practice, really just started thinking I need to come up with a solution, and the solutions actually don't seem to be that difficult here. We just need to be able to put it in place with technology. And so didn't honestly have too many conversations about this. I think it's something that I'd been thinking about for a long time. And then in April of 2021, just decided in the middle of a global pandemic with 4 kids at home, because all of the schools had been shut down, like that I wasn't going to wait anymore. Like that was the moment. I just needed to start doing something. And called my sister-in-law, Shema, who is a child and adolescent psychiatrist, and she's always held that a lot of the pediatric mental health crisis that we're seeing in this country is a result of stressed families, and stressed families often come from stressed moms, right? So if we really think about solving maternal mental health issues, we're solving long and downstream problems. And she was instantly on board. She was like, yeah, I've been thinking about this for a long time too, but we have to be really organized in how we do it. And we need to not fall into like lots of planning and perfectionism. We really already know the problem. We already know the space. Let's quickly come up with a sketch of like first, second, third phase. And we started literally like the next day. We started working on it. We got incorporated. And what I really took from her, which is kind of the opposite of myself, is that she is a doer. She's not necessarily like a let's sit and think about everything for 7 years before we implement. And we started really early in our company about implementing and getting feedback and getting out there before we had everything perfect. And I think that was really one of the early strengths.
That's amazing. I love doers. I'm so glad I'm invested. So tell me a little bit more about those early days. Like, were you guys both still practicing? Because obviously you have 4 kids, family to feed.
Yeah.
She she has children as well. And um, I know startup life is not financially great in the
Yeah.
beginning. So like, were you still working? How did you manage your finances?
Oh, absolutely. Yeah. So for the first 6 months of Luna Joy, we were both working insane hours. So she was doing her regular job. She was still very newly postpartum at that point. She had, a kiddo that I think was under a year old. And I had these 4 kids at home. I was still working in the health system. I was still doing my own private practice and then doing this kind of on the side. So those were definitely like 14-hour days. I will say, not to minimize it though, when you're working on a project that really has like a lot of significance and meaning, and you can see directly the line of impact, it does kind of take on a life of its own. It's not something where I felt like I was clocking in and clocking out and just had to get this and that done. Like it was a thing that I couldn't wait to get to at the end of the day after putting all the kids to bed. Um, and so those early days, I think, were a lot of work. I think also having the other things going on just for financial stability made us really focused, right? It's easy to waste time in the beginning when you have all of these ideas and all of the time, but because we didn't have that, we were really focused on what do we need to do to, get a provider group up? What do we need to do to get in network with insurance? How do we need to get people trained? And so that focus was really, really helpful.
In the beginning, did you guys decide like, okay, this is going to be our budget. You're going to put in half. I'm going to put in half. And did you guys budget out like what you were going to do
Yeah.
for 6 months?
We did. So, I mean, we decided we were going to be half and half and kind of divided the company that way. And we had put together a preliminary budget of what we were willing to self fund and how much money we were willing to put in. I will say that we grossly underestimated what it actually costs, right, to build not just a company, but a health tech company and to do all the things that need to be done. And so we probably ended up spending twice as much as we were anticipating we would put in. And so I think we'd gotten to the point where we had each put in about $80,000 to $90,000 of our own money. And I was starting to feel kind of like let's get really clear on, how much of our own personal investment we're willing to do. Are there other forms of investment we should think of, or do we just need to go slower? Or, how do we need to make sure that this is manageable? And that was really also at the point when we decided to apply to YC. And it was actually my brother who introduced us, who said, you should think about applying to this accelerator. It's really hard to get into, but it might be just a good thing for the company. And it'll be a good thing even just to fill out the application in order for the two of you to get really focused on how it is that you take the solution that you've built and how you're going to scale it and understand the bigger vision. And so we did that. We did the application. We actually made the application video in her closet, like over a break, and all the kids were running and screaming outside. And we're sitting there like between her sweaters, holding the little camera, talking about how we were going to solve women's mental health issues, and sent it off. And we got in. And one of the conditions and requirements of YC at that point was that if we do the cohort and take their investment, that we had to quit our full-time jobs. And that was actually probably like the biggest moment of decision making and stress for the both of us. Because it's one thing to work on something on the side, in addition to all the things that you've been doing, you feel financially comfortable and safe. And then it's another thing to kind of jump off this cliff when you have a good salary and a stable lifestyle and just decide that you're going to do something else. But we finally, we just thought about, well, okay, we could turn this down. We can continue to do it on the side. But the ability to have impact was so high. It was almost like mesmerizing. Like, how do you turn that down? How do you turn away from a problem that is so big where you can see like a very clear solution and a path forward? And so we did it. We did all the things. I wound down my private practice, took time off from the hospital. She did all the things. We got our husbands on a rotation with our kids. We actually flew them and their kids over to our house. And so both husbands could manage the 6 kids together. It was total chaos. And we went off to YC in San Francisco for the first 10 days of the batch and the last 10 days of the batch. And I mean, just thinking about like the scheduling and the rotation that we had to put everyone on and flying grandparents. And, I think once we had done all that and gotten investment from YC and made that commitment and sacrifice really on the parts of not just ourselves, but everyone in our family, we kind of were like, this has got to succeed. We got to figure it out. And it gave us really a lot of focus.
That's amazing. I mean, it really does. It takes a village. And, obviously, we're so lucky that you guys are working on this problem. And also, you're so lucky that you have this community that can support you, from your family to to your parents. And, people ask me that question. They're like, how do you balance things? And I'm like, I don't. I was like, I get a ton of help. I was like, I do
Yeah.
not balance. I was like, if you think that I am dropping my kids off to school and working on all my projects and, doing
Mhm.
all these, I'm not. I'm doing the
Yeah.
things that I love to do with my kids, and
Mhm.
I'm not doing a lot of other things. And that I've had to make peace with it, and it's just part of being an entrepreneur. And I think that it's not for everybody, but certainly it takes a village, and it's amazing. So when you say YC, because I know a lot of people don't know what YC is. So YC stands for Y Combinator, and for anyone watching, it's an incubator. It actually does a variety of different healthcare companies, and there's just, I mean, every sector, right, is pretty much represented in YC.
I was just going to say it's pretty agnostic. They do anything kind of related to tech, whether that's health tech, all the different kinds of tech.
So anybody can apply to YC, or do you have to have like minimum revenue generating requirements or anything like that?
Anyone can apply to YC at whatever stage. They really are looking for like a strong founding team, that the team has, some kind of unfair advantage in what they're building, and that they have an idea that could really be the next big thing. I think you don't have to have revenue. You don't necessarily even have to have like a fully formed idea. They've taken people at all different stages. So I would definitely encourage anyone who thinks that they have something that they want to kind of get to the next level to work on the application and to apply.
And what are the terms of YC? Like, what do they take a percentage, or what do you have to give them in return for all the mentoring, introductions, et cetera?
Yeah. So it's 7% of the company. That's kind of part of the standard deal they put in. And it's changed since we were there, but they put in initial sum of money. Right now, that money is 500,000. Part of it is for that 7%. Part of it is on an MFN. And it is an intensive, like, boot camp is the way that I would describe it. You kind of work on your company for 14, 16 hours. You go to their lectures, you get a lot of support from their group partners. And then you get a lot of support from the other companies in the YC cohort who are doing things that are similar, maybe in different fields, just learning and understanding from them. It kind of is this tank where, everyone's like ideas, energy, resources, connections are all kind of coming together at once.
How did you guys spend that initial, before YC? How were you spending the initial investment that you guys had made? What was the majority of that spent on?
The majority of that were spent on like the personal investment that the two of us made.
Yeah.
Yeah, it was spent on really just getting like basic structures in place. So to practice medicine, right, getting a structure that can practice medicine, getting credentialed, getting a managing organization for that. Lawyers cost a lot of money. My husband is one, so I can talk about that a little bit. But all these expenses that are just kind of part of doing business. And then the other probably big part of the expenses were hiring people, right? And that is a little bit of needing to make an investment before you know exactly how it's going to pan out. So, like finding people that you need to do the different parts so that you can actually move the business forward and not be doing all the little minutia yourself.
Right. And what about tech build out? Did that come later, or did you start some of that beforehand?
We started some of that beforehand. And again, like lots of different ways of doing that. You can build, in the US, you can build offshore, very different price points. And so prior to YC, we were really doing more of building out a framework. We had some basic tech pieces in place, most of which were off the shelf that you have to pay for, but nothing proprietary. And then once we got the YC investment is really when we were able to start building our web app and a lot of our algorithms and things like that, which were our own.
How did you find your tech team, like in the beginning? Because that's kind of a hard resource to find.
Yeah. And it's been a process. It's definitely been a journey, especially being non-technical. I don't code, Shema doesn't code. To figure out, what that fit is going to be is difficult. And so we brought on a CTO that we found through YC, and it was a good fit for the time. It wasn't a good long-term fit, but it was at least a place to start with someone who did have that background that we didn't have. And then as we started kind of building out the product, we became much more clear about who we were looking for in that tech seat and what needed to be built exactly and what that qualification from that person needed to be. And so there's definitely been a lot of iterations of our tech team and what it looks like and who's involved. And it's taken a year, but we've learned a lot.
Yeah, tech build out is really challenging because it's one thing, and I, as a physician, I can say who's dealt with a tech team before, it's easy to say, well, can't you just do this? And they're like, not really. Or we can, but it's going to take a year. So pick your poison. But yeah, it's definitely more challenging than people realize. So after you got accepted into Y Combinator, then you go out and Y Combinator, helps you raise your initial sort of seed funding. So is there like a requirement, like to raise a certain amount, or how does that work? Like,
No, there's no requirement to raise a certain amount. Part of the work during YC is really figuring out what that next phase looks like and budgeting for what it's going to cost, and then figuring out how to get and raise that amount of money. And so what YC is really good at doing is kind of putting you in front of the people that you could potentially raise from. There's demo day and there's anticipation leading up to demo day. So you start having conversations, and then after demo day, there's, out of 1,500 or 2,000 VCs that come and watch demo day, they ping you if they like you or let you know that they're interested. And then you go ahead and have all of these meetings. So it ends up being like rapid fire pitching and rapid fire raising. So a round that can otherwise take 4 to 6 months to complete, we got done in about 2.5 to 3 weeks. And a lot of the idea around raising is just figuring out what is actually the least amount of capital that you need in order to get to your next stage, not just go and raise as much money as you can, but really meaningfully. How much money do you need, and who are the investors that you want on your side? Who are the investors that are going to help you move your company to the next level, or at least not hinder it?
yeah. And how do you guys decide that initial sort of valuation when you're not really making a ton of money and you don't have a ton of data about the business?
Yeah, well, I think just by function of being a YC company, having that mentoring, having that like very intensive period of time to build, there is a little bit of a bump that goes into valuation. And historically, YC companies do very well if you look at the percentages of companies that become unicorns and things like that. But it is very difficult to come up with valuation at early stage when there isn't a ton of data to look at. And so I think most companies are based on, who's their founding team, what is their idea, how likely is it that this idea is going to be the next billion-dollar company? And the ability to really clearly, this is, I think, really underrated, but the ability to really clearly talk about what the problem is that you're trying to solve, what you're going to do, and what the steps are in order to get that done. Valuation numbers, we asked our group partners what they thought. We asked a number of other YC companies what they thought, and then we took our numbers to investors and we pitched and we got feedback that way. And we just kind of moved on from there. But it's a number, and especially for us, raising on a safe, it's less important what that first number is, whether it's a little bit up or down. It is really important, though, to develop a good cap table that is going to be a good partner as you scale.
Yeah, no, and YC definitely has a great network of people to introduce you to. So there's definitely no shortage of that. I find it funny that like you actually introduced me to YC because you were your brother that introduced me to you, and you had called me for advice. And I was like, wait, I don't want to just give you advice. I want to give you my money. Because I was postpartum, and when we talked, and I think like it was like the first time I left the house in 3 weeks was to do the wire transfer. I was like, my husband's like, what are you doing? I was like, I gotta go to the bank. He's like,
it was your investment that really kicked off our round, because we thought we would kind of be traditional and wait until the end of YC to start raising. And I remember when I had that first meeting with you, it was literally just for advice. And, someone told me you're always pitching, even when you're asking advice, you're pitching. And didn't really understand what that meant. And then I understood what it meant after we had our conversation. But we had our conversation, I was asking for advice, and you were like, I want to invest. I remember getting off the phone with you, or getting off the meeting with you, and telling Shema, like, Saya wants to invest. I think we need to start fundraising right now. And she was like, let's do it. So you started our round, and we had like amazing momentum from there, and we were able to close it very quickly. So
yeah, no, that's awesome. I was, well, it's funny because there's like this song where it's, I can't remember what it is. I'll have to like find the lyrics to it, but it's like, ask for money, get advice, ask for
Yeah.
advice, get money twice. Who am I quoting? I'm quoting, what's his name? He's like, oh God, I'll have to figure it out and like splash it in here. But no, it was really, I'm really happy to see what you guys are doing, happy to see the growth. What is going on with the growth? I know you can't kind of get into specifics, but what's it been like? How many states are you guys operating in?
Mhm.
And how has the growth been over the last 2 years?
Yeah, so the growth has been great. I think that there's so many tailwinds that are helping us along. And like as a reproductive psychiatrist, I'm very excited that we finally have data that's being published, by the CDC, by the health insurance companies on what a big problem this is, on what the costs are. And so there's definitely much more motivation, I think, to address a lot of the issues that we're treating than there were even 2 or 3 years ago. In terms of growth, we've been growing month on month. It's been very like healthy, good progress. We've developed a lot more tech integration, which has made things even more seamless. And so right now we're actively operational in 7 states. We have providers that are now licensed across 22 states. And so we're just kind of at that next level of growth and going into more states, more OB offices, into health systems and things like that, so that we are partners at every positive screen, that there is someone else alerted that's responsible for helping that patient get into care and then actually delivering care.
And is that the main way that you guys are growing, is through OB offices and pediatric offices, is plugging in with them and saying, hey, when you have a new mom, and if she needs extra help with in the mental health space,
Mm-hmm.
taking them from that point in the journey?
Yeah.
So how does insurance play into all of this? Because we know that insurance has traditionally not been part of psychiatric care in this country, which is unfortunate because so many people have so many things, especially with the way the world is going. I feel like mental health is becoming a huge burden.
Mm-hmm.
Post COVID, social media is obviously really impacting people's health. So how does insurance play into your model? And how do you guys make that work?
Yeah, so insurance was a really big part of our structure early on. We knew that if we wanted to make something that was not only great, but also accessible and sustainable, it had to be in network with insurance. And I think that that was a really big departure from what most other mental health companies were doing at that time, where they were trying to do subscription models and fee for service, cash pay models. But because what we know about women, all the statistics are, women will sometimes be able to pay for out of network care for their kids, maybe even their partners. But when it comes to their own health, they typically will not pay out of pocket unless they have no other choices. And when they do pay out of pocket, their rates of discontinuation tend to be much higher. So we knew that working with payers was going to be a big part of what, we needed to do. And so we applied for insurance contracts, and we've been working very closely with a couple of payers specifically that have been very interested in working on this population to get better rates, to get rates that help cover a lot of that care navigation, rates that help cover a lot of the very specialized services around things like peripartum OCD and, things like that. And that's, its own maze. Working with payers, every payer is different. Every payer is going to have different incentives. They have different decision makers. They are and aren't willing to accept different structures of payments and things like that. So it's been a very manual kind of step-by-step process, but we've definitely made a lot of progress and have come down with some pretty good arrangements that make this care not only more sustainable for patients, but really more sustainable for us as a business in order to be able to continue to pay our providers and deliver care.
Yeah, in this country, so many people don't have insurance, but so many people do have insurance. And if you have insurance, you want to use it. So, working with insurance is a big deal in mental health, because it's really, most mental health providers don't work with insurance. So I think it's huge in terms of increasing access to care and sustained care, because mental health is not something like, oh, you have a cataract and you
Yeah.
take it out and now it's gone. It's like, okay, well, anxiety might even just get worse as you get old. I mean, that's what I'm experiencing, at least with having kids. I'm like, oh, this is not getting better. This is just, they're getting older and I'm getting more anxious. So no,
There's
really.
a a lot of mental health is chronic management, right? It is just like you said, it's not a cataract, and we can get people better and we can get people feeling better, but that also requires constant engagement, whether that's follow up and management appointments or even just follow up like maintenance therapy appointments.
So if you're in an OB office, like you already have a partnership with an OB office and you already kind of cross-referenced the insurance component, or how does that work in terms of like, okay, now the patient is there, they screen positive for postpartum anxiety. Is it fairly seamless, or do you still have to do another insurance check after that?
It's fairly seamless in that we do that work on our back end. So most of that is automated. When we have a positive screen, we're able to tell right away whether we're in network or, even within our provider group, there can be different people that are in network and aren't in network. So pretty instantaneously, we have the information about how that patient can get plugged into care with Luna Joy, and then we transmit that information to the patient.
So this is actually not only a great resource for patients, but also a great resource for OBs, because it kind of takes that burden off of them. Like, oh, did you go to your mental health provider? Did you get that done? Right. Because that's unfortunately, in the world we live in, that's not something that's really a covered service. Right. So these are all things that doctors have to go above and beyond to make sure that their patient is getting the care. And the way the system works, it's just sometimes there's just not enough time in a visit to do that. So if you do screen positive at your OB office, Luna Joy being able to kind of take that off of not just the patient's hands, but also the OB's hands is obviously really, really helpful. So
Yeah.
that's a great.
It's an interesting thing, right? Like if you go to your OB office and you screen positive on your glucose tolerance test, there's like a specific pathway from there, right? We don't just leave it positive. We'll treat you for gestational diabetes and things like that. And so similarly, when someone is screening positive right now on their EPDS, there is no traditional pathway, and the work really is all on the patient and the OB to make sure care has happened. We can't just keep on putting more and more requirements on our OB colleagues. They already have thousands of things that they need to accomplish during those 9 months. And that is where the onus lies, right? That's where the liability lies. It's where the onus lies. And so the goal here is to not add one more thing that the OB has to do. In a lot of our integrations, they don't even have to click anything. We actually can see it through their EMR. And so it is one less thing that they have to think about. We have very good, even backward communication with the OB about the patient receiving care, sending notes. And so it is meant to be very helpful to the patient. And I think the side effect is that it helps the OB focus on all of the other OB things that need to happen during pregnancy while we take care of the mental health issues.
And also pediatricians, right? They can also refer clients to your service.
Correct, right, because they're actually doing most of the screens. They're typically screening about 4 times in those first 6 months. And mom isn't even their patient. So they're getting positive screens on someone that's not their patient, which also leaves them with a to-do, a liability, kind of totally outside of their purview. And so the integrations that we've had with pediatricians also has worked very well in terms of taking stuff off of their plate.
Before we get to the last part of this interview, go ahead and hit the subscribe button below. It helps our channel as well as all the people that we interview. And if you find this video interesting, be sure to share it with a friend. Thanks. So what do you see for Luna Joy in 2024?
I think we are going to double down on the things that have already been working very well for us. We're going to be expanding states. We're going to be expanding to hospital clinics and larger systems. We're going to continue to do that through both technology as well as hiring more people, getting more people, whether they're MDs, DOPs, NPs, therapists, LCSWs trained in reproductive mental health, so that there's just more of a population taking care of these patients.
No, I'm really excited. I'm really proud of what you guys are doing. I'm proud to be an investor, a supporter, an ally, however I can help. Such an important thing, mental health, obviously for women. And I know you guys are thinking about this, but I'd love to see you guys go into pediatric mental health as well. Because just now that I have kids, I think that there's just so much that goes on. And that's kind of scary to think about the lack of resources that we have, and to imagine having to like not have guidance. And even if you're willing to pay, I mean, access is crazy. I mean, I know friends that are willing to pay for their out of pocket for their psychiatrist, for their child psychiatrist, and the wait time is months, and the coordination is terrible, and it's one hand isn't talking to the other, and it's just a big mess. And it's really sad when it's your child and you're in those like young formative years. So I know it's not on your 2024 roadmap, but I'm hoping sometime down the line. But I'd love to do a follow-up interview maybe in a year if you guys are open to it, and see kind of where we're at. And yeah, just really,
Would
really
love.
awesome. Thank you so much for being here.